and welcome to How to Gastro. In today's video, we'll be exploring a very interesting topic, and that is croup, which is also commonly known as laryngotracheobronchitis. So let's get started. So what is croup? Croup is a common, primarily pediatric viral respiratory tract illness which causes swelling around the little one's vocal cords. Croup generally affects the larynx and trachea, but may also extend to the bronchi. This is why it's also given the name laryngotracheobronchitis. Laryngo stemming from the larynx, tracheo stemming from the trachea, and bronchi stemming from the main bronchi. And the term itis refers to inflammation in the area, hence the name laryngotracheobronchitis. So children with croup usually have a telltale barking cough, which is often compared to the sound of a seal's bark, and a raspy voice. And they usually make a high-pitched squeaky noise when they breathe. So from this definition of croup, we get that it's actually a very common pediatric viral respiratory infection, and it actually causes the swelling around the little one's larynx, trachea, and bronchial areas. So this is what the normal larynx looks like. Here we have our vocal cords and then the trachea, and this is what the anatomy looks like in patients with croup. We have an inflamed laryngeal area, as we can see the swelling around the vocal cord structures. And this is usually due to a viral infection within this area. So the main structures that are usually affected by croup are the larynx, trachea, and main bronchi, and this is why the disease is also called laryngotracheobronchitis. So now that we know what the basics of croup is, let's take a closer look at how one can contract this disease. So as we mentioned in the slide before, the main cause of croup is a viral infection. So there are several viruses that can actually cause croup, but the majority of cases come from the parainfluenza viruses, which are the common cold viruses. But other viruses that may also cause croup include adenoviruses, which are another group of common cold viruses, the respiratory syncytial virus, or RSV, which is the most common germ which affects young children, usually under the age of 1 and 2, as well as the measles virus. And croup may also be caused by allergies, exposure to inhaled irritants, or even sometimes bacterial infections, but these are usually rare. The signs and symptoms of croup. So croup often begins as a typical cold, and if there's enough inflammation and coughing, the child will go on to develop a loud barking cough that's further aggravated by crying and coughing, as well as anxiety and agitation, setting up a cycle of worsening signs and symptoms. These children will also suffer a fever, a hoarse voice, breathing that may be noisy or labored, a rash, eye redness, and swollen lymph nodes. So the inflammation of this focal respiratory area, which is the larynx, trachea, and bronchi, will of course cause this noisy breathing, this loud barking cough, because an inflamed and irritated airway is a narrowed airway. So these children are actually gasping for breath, which causes their breathing to be noisy or labored, as well as the hoarseness in their voice because of the swelling around those vocal cords. So these are all the signs and symptoms of croup. The diagnosis of croup. So the doctor will listen for the telltale cough and the stridor. They'll also ask if a child has had any recent illnesses that has caused a fever, runny nose, and congestion, and if the child has a history of croup or upper airway problems. A neck x-ray may also be requested if the croup is severe and slow to get better after treatment. So the diagnosis of this disease is usually a clinical one and is based on the telltale signs and symptoms such as that barking cough, the loud breathing, as well as a recent cold, which includes fever, runny nose, congestion, etc. And finally, let's talk about the treatment of croup. So most cases of croup will clear up with home care in about 3 to 5 days. However, a doctor may prescribe a steroid for a persistent case. A single dose of dexamethasone, usually 0.15 to 0.6 milligrams per kilogram, will be given to the patient orally, and this is usually given once off. And nebulized epinephrine is also an accepted treatment and can be given to patients with moderate to severe croup. And that brings us to the end of this presentation on croup. Thank you guys so much for watching. Hope you found the presentation very interesting and informative. Please make sure to like, comment, subscribe, and share. And please make sure you turn on your bell notifications so you'll be notified every time we have a new upload. If you'd like to download a copy of this presentation, you may do so by clicking the link in the description. Take care and bye for now.